The Hickory Hound presents.
We continue with Hickory, North Carolina's Compendium of Socioeconomic and Cultural Intelligence for June 2025. Health isn't just about hospitals. It's about where you live, what you earn, what you eat, and whether you feel safe walking down your street. These are called social determinants of health, and in Hickory, they vary from block to block, zip code by zip code. On paper, the city looks covered. Catawba Valley Medical Center and Fry Regional Medical Center anchor the formal system, alongside urgent care clinics, specialty practices, and an expanding behavioral health sector. But that infrastructure isn't evenly experienced. There's a provider shortage, fewer primary care physicians per capita than needed, mental health specialists in short supply, dental care out of reach for many without private insurance. And even when care exists, access remains unequal. Transportation is a barrier. In parts of Longview and East Hickory, patients without reliable cars struggle to reach appointments. Greenway buses don't run evenings. Some neighborhoods have no nearby pharmacy, no walk-in clinic, and no urgent care. Then there's the insurance problem. A significant portion of Hickory residents fall into the coverage gap. Not poor enough for Medicaid, not secure enough for private plans. High deductibles, copays, and pharmacy costs lead people to delay care, ration medications, or skip treatment entirely. Mental health is a growing concern, especially for youth and seniors. School counselors are overwhelmed. Wait lists for therapy stretch for weeks, and stigma remains strong in certain communities, particularly among men and working-class families. But health isn't confined to clinics. Food insecurity affects 1 in 7 citizens. Some areas, like parts of Ridgeview, Highland, and Startown, qualify as food deserts. No full-service grocery store, just fast food, gas stations, and corner markets. The consequences? Higher rates of obesity, diabetes, and hypertension, especially among low-income children and elderly citizens. Environmental factors compound the challenge. Aging rental housing with mold and poor ventilation contributes to respiratory issues. Lack of green space limits mobility for seniors and kids alike. This is why Hickory must adopt a broader definition of health, one that connects housing policy, transportation, education, and nutrition with medical care. Solutions exist. Expand mobile health clinics to underserved areas. Co-locate behavioral health services inside schools, libraries, and community centers. Fund transit vouchers for medical appointments. Integrate fresh food programs with neighborhood hubs and schools. Launch a community health worker program to connect vulnerable residents to services. Digital health is a bright spot. With MetroNet and BEAD funds expanding broadband, telemedicine is more viable than ever, especially for rural seniors and working families. But digital literacy and device access must be addressed alongside connectivity. Above all, health equity must be built into every policy, because where you live shouldn't determine if you live. Life expectancy in Hickory varies dramatically between neighborhoods. That's not genetics, that's systems. The next step isn't more hospital beds, it's upstream investment. If we want to reduce ER strain, improve educational outcomes, and create economic stability, we have to treat health as infrastructure, not just service delivery. Public health must be visible, local, and integrated, because no city can thrive while its citizens are struggling to survive. Health is not a side issue, it's a foundation of everything else we hope